In this video, I'll introduce the Lumbar Denneroll and explain how it's used for home lumbar extension traction to conservatively improve straightening of the lumbar spine, reduce symptoms, and support long-term spinal health as part of a structured rehabilitation program. I'll walk you through what straightening of the lumbar spine actually means, also called flat back syndrome, why this loss of lumbar lordosis can contribute to back and leg symptoms, and how lumbar extension traction has been shown in published research to help restore the natural curve of the lumbar spine. I'll also explain how the Lumbar Denneroll is prescribed for safe home use, who it's appropriate for, and how it fits into a research-based corrective care plan. By the end of this video, you'll have a clear understanding of what you can do at home to address straightening of the lumbar spine, the role the Denneroll plays in improving lumbar curvature, and how conservative care can be used to reduce symptoms and help prevent future problems. I'm Dr. Graham Jenkins, a corrective care chiropractor in Kelowna, British Columbia. I help patients restore their health, mobility, and confidence through advanced, non-surgical spinal rehabilitation. I'm one of only a few doctors in the world who are advanced certified in chiropractic biophysics, and one of just 3 on the entire west coast of Canada. My mission is simple: to help people live strong, active, and pain-free lives for as long as possible. I do that by focusing on real correction, not just pain relief, helping people fix the root cause of spinal problems that have held them back for years. On this channel, you'll find clear, evidence-based videos that explain how your spine and nervous system work, why posture matters, and what you can do to move and feel better naturally. If you're ready to take control of your health and start moving without fear again, subscribe to the channel. You'll discover practical, evidence-based ways to correct your posture, protect your spine, and keep your body strong for life. I upload a new video every week. Before we talk about correction, it helps to understand what the lumbar spine is meant to look like. From the side, a healthy lower back has a natural elliptical shaped curve called a lumbar lordosis. This deepest part of the curve is in the lower segments, especially around L4 and L5, and L5 and S1. This shape allows the lumbar spine to manage load efficiently by spreading forces across the discs, joints, and surrounding tissues during daily activities. When the curve flattens or straightens, known as straightening of the lumbar spine or flat back syndrome, the spine loses that ability. More stress is placed on the discs and the joints, which can contribute to back pain, leg symptoms, and degenerative changes over time. This is more than just stiffness. It's a structural distortion in spinal alignment. And a structural problem requires a structural solution, which is where lumbar extension traction comes in. When the normal curve in the lower back is reduced, the spine has a harder time doing its job. Instead of spreading load evenly, more stress gets placed on the discs, joints, and tissues during everyday activities like sitting, standing, and walking. That extra stress helps explain why symptoms often stick around. Back pain may not fully settle down, and in some cases, discomfort or symptoms could travel into the hips or the legs. This is not because the spine is fragile, but because it's working in a less efficient position. The important thing to understand is that these symptoms usually do not resolve by just waiting or resting. As long as the lumbar curve remains flattened, the spine continues to handle stress poorly. That is why long-term improvement often requires addressing the shape of the spine itself, not just the pain. General exercise and stretches can improve strength and flexibility, but they're not designed to change the spinal shape. Most exercises are active and brief, which means they do not apply enough sustained load on the spine to create a lordosis. Generic lumbar rolls are not corrective tools. They're usually too large to target specific lumbar segments. When people try to use these rolls for traction, they can irritate the spine and make symptoms worse rather than better. This is why we use specific corrective protocols from chiropractic biophysics. In CBP, spinal correction is based on mirror image traction, which places the spine in the opposite position from its deformity. For straightening of the lumbar spine, that means lumbar extension traction, where the spine is positioned in extension so tissues can adapt over time. This approach follows well-established principles of viscoelastic ligament remodeling. The traction is passive, precise, and time-based, not aggressive. When applied correctly, lumbar extension traction encourages restoration of lumbar lordosis by addressing spinal shape directly. In a moment, I'll show you how this is done at home using a spine orthotic like this called the Lumbar Denneroll. First, let's talk about the research. Research from Chiropractic BioPhysics has shown that the lumbar lordosis can be restored using lumbar extension traction. A systematic review of CBP studies reported average increases in lumbar lordosis of approximately 7 to 11 degrees over just 10 to 12 weeks of care. Comparison groups receiving conventional treatments did not show meaningful curve restoration. Follow-up studies demonstrated that these improvements were maintained at 6 months or even longer. One randomized trial specifically used a Lumbar Denneroll orthotic as the traction device, and it showed improvements in lumbar curvature, pain, and disability. These findings support sustained traction-based correction rather than symptom-focused care alone. What I want to introduce next is the home traction spinal orthotic we recommend and prescribe to patients with straightening of the lumbar spine. This is called the Lumbar Denneroll. It's not a general lumbar support, and it's not designed for comfort during sitting. The Lumbar Denneroll is a corrective spine orthotic used for home lumbar extension traction as part of a structured rehabilitation program. The shape of the Lumbar Denneroll is intentional. You'll notice that it's got a defined peak rather than a flat or rounded surface. That design allows it to target the lower lumbar segments, especially L4, L5, and L5S1. These are the segments where a normal lumbar curve should be deepest. When the lumbar spine straightens, these lower segments often lose the most curvature, which is why correction needs to be focused there rather than spread across the entire lower back. When the Lumbar Denneroll is placed correctly under the lower back and the patient lies on a firm surface in a supine position, so that's on their back, body weight creates a controlled 3-point bending effect. The pelvis and upper trunk provide support, while the Denneroll applies a sustained extension load to the targeted lumbar segments. This positioning helps recreate the normal shape of the lumbar spine, which is deeper in the lower segments and gradually flattens towards the upper lumbar region. The goal of using the Lumbar Denneroll is not stretching or forcing movement. The goal is to apply sustained, precise positioning that allows spinal ligaments and supporting tissues to adapt over time. These tissues are often shortened and stiffened when the spine is held in a flattened position for long periods. Lumbar extension traction helps guide those tissues back towards a healthier length and tension that supports normal lumbar lordosis. This is done in combination with in-clinic care and specific extension exercises. When used as prescribed, the Lumbar Denneroll becomes a safe and effective way to support long-term correction of straightening of the lumbar spine at home. It's important to understand that the Lumbar Denneroll is a prescribed spinal orthotic. It's not for everyone, and it's not an over-the-counter product. The Denneroll is available in different sizes, small, medium, and large. The yellow one is small. As you can see, these ones are higher, medium, and large. And the correct size is chosen based on the patient's height and spinal flexibility. A stiffer or more symptomatic spine often requires a smaller Denneroll to start, even when curve loss is significant. More flexible spines can tolerate larger sizes sooner. Orientation also matters. The Lumbar Denneroll can be positioned with the peak oriented differently depending on the correction goal and the spinal segment being targeted. Certain orientations emphasize the lower lumbar extension, while others are used when correction is needed slightly higher. Orientation is chosen deliberately to match the individual spinal pattern rather than applying the same setup to everyone. Placement is never guessed. X-ray analysis plays a central role in determining where the Denneroll is positioned, and X-rays are used to evaluate lumbar curve shape, segmental contribution, and overall spinal balance. In many cases, flexion and extension views are taken to rule out the spinal instabilities before traction is prescribed. In select cases, correction potential X-rays are performed with the patient positioned on the Denneroll to confirm that the setup produces the intended mirror image correction. Now, this level of specificity is what separates chiropractic biophysics and traditional corrective chiropractic care from trial and error. When size, orientation, and placement are prescribed correctly, the Lumbar Denneroll becomes a precise, home traction tool rather than a generic device. That precision is what keeps the approach safe and effective over time. When lumbar extension traction is prescribed, following the protocol matters. Patients typically start with 4 minutes on the lumbar Denneroll and increase by 1 minute every other day as long as it's well tolerated. Over time, this gradually builds towards sessions up to a maximum of 20 minutes a day. And again, this is normally done once per day, though twice daily produces better results. Before using the Denneroll, specific exercises for straightening of the lumbar spine are performed first. These exercises activate and strengthen the supporting muscles and help warm up spinal tissues, which improves tolerance and increases the effectiveness of traction on ligament adaptation. I've covered these exercises in another video, which I will link in the description. So the Denneroll is used with you lying on your back on a firm surface. Legs are usually kept flat for the greatest effect, although the knees may be bent at first for comfort. Often I'll have patients use a pillow underneath their calves to make their ankles at the same height of their pelvis. So during use, it's important to watch for warning signs such as increasing pain, numbness, dizziness, or spreading symptoms, and to stop if any of these occur. Certain conditions are clear contraindications for lumbar extension traction, including fractures, dislocations, tumors, and spinal infections. In other cases, imaging may reveal instability patterns such as anterior lordosis. When this is present, lumbar extension traction with a Denneroll is not the starting point. Different in-office corrective procedures are used first, which I've covered in other videos. Imaging also helps us evaluate other factors that affect candidacy for home traction. Severe spinal degeneration, acute disc injuries such as disc herniations, nerve compression, and central canal stenosis all require careful consideration. In these situations, home lumbar extension traction may be delayed, modified, or avoided until the spine is better prepared. The key takeaway is that home traction is never guessed. Imaging guides decision-making, so the right corrective approach is used at the right time and only when it's appropriate and safe. You now have a clear understanding of what straightening of the lumbar spine means, why it matters, and how we use home spine orthotics called Lumbar Dennerolls as part of a structured, research-based rehabilitation program to help restore lumbar lordosis safely. This approach is conservative, non-surgical, and focused on long-term spinal health rather than short-term symptom relief. Progress comes from consistency, proper prescription, and using the right tool the right way. And if you found value in this video, please like it and share it with someone who may have been told that they've got a flat back syndrome and were never given a clear plan. If you've got questions about anything I covered today, leave them in the comments. I do read them, and they often help shape future videos. I always recommend working with a certified chiropractic biophysics doctor and getting a full spine and posture analysis to determine whether lumbar extension traction is appropriate for you. If you need help finding a CBP doctor in your area, let me know in the comments below and I can point you to the online CBP doctor directory. If you want to take control of your health and start moving without fear again, subscribe to the channel. You'll find practical, evidence-based ways to correct posture, protect your spine, and keep your body strong for life. And the next video you should watch is this one. If you want to see the 4 at-home exercises I use to specifically target straightening of the lumbar spine, go watch that video next.